We are now engaged in a brutal struggle against this coronavirus. The virus appeared sometime in December or January, but only in the last 2 weeks have most Western countries been decimated by it. And each of them has followed a similar strategy, modeled after a study that was presented to the President of the United States and Boris Johnson in or around March 11th. That study looked at the models from China and a bit of South Korea and concluded that if you allow the virus to spread and do nothing, your hospital system will be overwhelmed and your ICUs will not have enough space. So the conclusion of the study was that you can use several methods to suppress or mitigate the pandemic, and those methods would include school closures, isolations, quarantine, and social distancing. However, many countries believe that they've entered this, what they call the curve, which is the curve of the number of cases, a bit late, and they decided to lock down their societies, which is wreaking havoc on their economies and bringing global travel to a halt and closing borders and all sorts of unprecedented measures. And they don't seem to be working. And that's partly because most of these countries don't even know how many cases they have, so they entered into a kind of war of attrition with this virus without even knowing much about their enemy. And consequently, media and government officials are less inclined to be careful, and they're grasping at straws and lashing out. And what's happening is that the cases keep climbing, and they say, well, you're going to wait 2 weeks. But actually, the study said you'll have to wait till September or maybe 18 months, and that you'll have rolling infection rates, and these ideas like herd immunity will pop up. So the big question that hangs over most of these countries is that you can't just do this forever. And in China and South Korea, they did not lock down the whole country. They didn't bring their economies to a grinding halt. So it's not even clear if the models that they're following are based on models that actually existed. And that leads to many, many questions, I think, about what's going to come next. So one of the concerns that we have is what's called the so-called second curve, which is the curve of the economic problem. And even though you might flatten the pandemic curve, it's not clear that there's a solution to flattening the economic curve. And that brings to mind another point, which is that there does not seem to be an understanding that most countries in the global south will have difficulty locking down their societies forever, and that you therefore have some countries probably that are smaller that can put in place these drastic measures, but some countries can't. And so what does that mean? That they'll have to just always have borders closed, and that there will be some parts of the planet that are just off limits or something? No one has really considered this. Most of these places are just enacting policy as quickly as possible. They still haven't even bothered to fully test their societies. There is perhaps not an example of any place where they've tested everyone. So in each case, you don't see the model even playing out the way they think it's going to play out, which is that you wait 2 weeks and the curve changes. Most Western countries are now, at least in the first week or second week, Italy has been going on for weeks, and there has not been a great change, which I think must lead some to wonder if the models were correct or how it works or what they've done wrong. And the idea that most of these countries can just put through massive stimulus packages to fix this is also problematic because you can't just print money or you'll have inflation and other problems. So those stimulus packages are also not entirely thought through, and it's not entirely clear if any of them are even working or will work. And that leads to another point, which is, how is it possible that most of these countries, the most developed, wealthy countries in the world, most of them seem to have shortages in many basic things and an inability to do many basic things, which shows how many of these countries have become a bit lethargic in terms of the things that they're very good at, which is things like healthcare. So it means that we are still engaged in a struggle against an enemy that most countries, even the most advanced ones, don't really know much about.